Next special test is going to be the Finkelstein Test. This is to assess for tenosynovitis. For this one, what I'm going to ask the patient to do is put his thumb inside of his fingers, and then I'm going to ask him to ulnar deviate his wrist downwards. If this causes pain or discomfort over the dorsum of the thumb, then that would be a positive sign for a tenosynovitis of the thumb, or it's also called de Quervain's disease or Hoffman's disease. The next special test is called the Watson's test. Watson's test, for this one, the examiner is going to palpate the scaphoid bone, find the scaphoid bone both anterior and posteriorly on the hand. And then what they're going to do is they are going to, in combination, they're going to do ulnar deviation and wrist extension. See if that causes any pain. Or dislocation of the scaphoid. And then they're also going to do radial deviation and wrist flexion and see if, again, the scaphoid dislocates or fractured at the scaphoid. So you're feeling for the scaphoid to clunk or shift, indicating either a fracture or a dislocation of the scaphoid, or subluxed. That's it. Next special test we're going to do is going to be for carpal tunnel or the median nerve. First one is called the Valence Test. For this one, we can either do it one-handed. We're going to have the person just plantar wrist flexion to extreme. So we can either do this with one hand, or we can ask him to put both hands together so he's hyperflexing his wrist, and that should cause pain or numbness down along the median nerve, tingling sensation down the thumb, index finger, or middle finger. Again, indication for carpal tunnel or median nerve injury, and that's the Valence Test. The next one is going to be for the tinel sign. For the tinel sign, what we're going to do is have his palm up and relaxed. And for this one, we can either use a neurological hammer or our finger and just tap on the median nerve as it crosses the carpal tunnel here at the wrist. And again, that would cause a tingling down the thumb and first or second digits on that side. Again, an indication for a positive carpal tunnel syndrome or median nerve damage. Next assessment is going to be for ulnar nerve dysfunction, and this one is called the paper squeeze test. For this one, we're going to have the patient try to hold the piece of paper between his fourth and fifth finger. And if he's unable to do that, that would be an indication for ulnar nerve pathology. That's the paper squeeze test. That's it.